Thank you so much, Harry. Well, just one of the new things for the new conditions of participation will be infection prevention and control, and it will be under Regulatory 48470. Now, in the past, we've been cited several times by surveyors, agencies have, for infections, such as maybe your clinicians didn't wash their hands properly between glove changes and those type of things. But now it's formalized into not just the practice of care, but it's actually a condition of participation where you can ultimately receive monetary sanctions. So let's talk a little bit about it. Our objective today is to identify the 3 standards under infection prevention and control, to define different standard precautions. We are going to discuss ways to prevent infection and control the spread of infection, and determine different methods to teach employees and patients infection prevention and control. So just a little bit of statistical background. In 2011, healthcare-associated infections claimed the lives of 99,000 people every year, according to the CDC, and several nationwide initiatives are linked to reducing the risk of adverse events and increasing patient safety, mainly from hospitalization or the hospital environment. There are no home health stats regarding infections, and I assume that once we start putting this into practice and it's a consistent theme across all agencies, that they may start collecting stats. The CDC stats for the acute care hospitalizations and IRFs, the most recent data was 2014 that was published in 2016. There was a 50% decrease in the central line and bloodstream infections between 2008 and 2014 because they put measures in place to reduce those infections. There had been no change in overall catheter-associated UTIs between 2009 and 2014, and there has been a 17% decrease in surgical site infections related to the 10 select procedures tracked in the previous reports. There has been an 8% decrease in C. diff infections between 2011 and 2014, and a 13% decrease in MRSA between 2011 and 2014. So you can see that they're tracking and trending those typical types of infections. And it appears that most of them have gone down, and a lot of that has to do with the infection prevention and control methods that they put in place. So under the 48470, the agency must maintain and document an infection control program, which has as its goal the prevention and control of infections and communicable diseases. An infectious disease is a disease caused by a microorganism and therefore potentially infinitely transferable to new individuals. It may or may not be communicable. An example of a non-communicable disease is a disease caused by toxins from food poisoning or infections caused by toxins in the environment, such as tetanus. So it's not communicable from person to person. You acquire it in different methods. A communicable disease, on the other hand, is an infectious disease that's contagious and which can be transmitted from one source to another by infectious bacteria or viral organisms. We know that each county has reportable communicable diseases to the CDC. Now, we often won't see that in home health and hospice. We won't be that first line, but occasionally we do have, let's say we have a patient that we're taking care of in home health. They have signs of active TB. The doctor calls us, they're homebound, wants us to do a TB skin test, and then we then get that report that they came back as a TB skin test positive. We may have to call the health department and go through that whole reporting mechanism that we've discovered that this patient now has TB. There are mandatory written reporting in each county, and that's something that you need to find out from your county. What are your communicable diseases that are reportable, and include that in a policy for your infection prevention and control. Um, some of those things that are reportable have to be done in writing, such as the gonorrhea and the salmonella. For this is an example, or measles and whooping cough. Again, you see these in settings outside of home health, but it could be that you see them also in home health.